What is AIDS? This is a condition in which a person experiences various types of infections due to the progressive destruction of immune system cells by the human immunodeficiency virus HIV. AIDS represents the end stage of infection by HIV. Facts about AIDS. In the 2 decades, the first 5 cases were reported in 1981 and 22 million people died of AIDS. Worldwide, 35 to 40 million people are currently infected with HIV. History. The origin of the AIDS pandemic found in the 1920s in Kinshasa in the Democratic Republic of Congo. This verified the case from a blood sample taken in 1959 from a man living there. It is likely that HIV enveloped from a chimpanzee virus in Africa, which is simian immunodeficiency virus, SIV, a virus closely related to HIV, being hunted and eaten by people living in the area. Some famous artists suffered because of AIDS. Arthur Ashe. He is an American professional tennis player who revealed he had AIDS in April 1992 because of a blood transfusion related to heart surgery. He died of complications from AIDS in February 1993. Amanda Blake. She is the well-known actress from the TV show Gunsmoke in the 1960s who dies because of liver failure brought on by AIDS-related hepatitis. She died in 1989 and believes she got the virus from her AIDS husband who dies of AIDS. Ryan White. He is the first child who an American teenager from Kokomo, Indiana, gets the disease of AIDS-related pneumonia following the blood transfusion at the age of 13 years. He died 5 years later in age 70 years in the 1990s.
Causes of AIDS. AIDS is a disease caused by the human immunodeficiency virus HIV that damages your immune system over time and causes AIDS. AIDS stands for Acquired Immunodeficiency Syndrome, which is the final stage of HIV when the immune system is damaged. How does HIV lead to AIDS? HIV destroys CD4 T cells, the white blood cells that play a significant role to fight disease in the human body. When they are destroyed, CD4 T cells decrease in the human body, which causes the immune system to become weak as it cannot fight infection. The HIV infection could last for years before it turns into AIDS. It is diagnosed when the CD4 T cell count falls below 200 or when there is defining complication associated with HIV, such as serious infection and cancer. HIV could spread through infected blood, semen, or vaginal secretions that enter the body. The spread of HIV infection can happen in several ways. First, by sexual contact. Infection may occur when a non-infected person has vaginal, anal, or oral sex with an infected partner whose blood, semen, or vaginal secretions enter the body during sexual activity. Second, by sharing needles. Sharing contaminated IV drug paraphernalia such as through needles and syringe leads to a high risk of HIV infections as well as other infectious diseases such as hepatitis. Third, from blood transfusions, the infection may occur when the virus is transmitted through blood to a non-infected person during blood transfusions. Lastly, the HIV may spread during pregnancy or delivery or through breastfeeding. The infected mothers can pass the virus onto their babies unless they get treatment for the infection during pregnancy.
Did you know what are the signs and symptoms of AIDS? If you have HIV and you are not getting any HIV treatment, eventually the virus will weaken your immune system and you will progress to AIDS. This is the last stage of HIV infection. The main symptoms of AIDS is it would affect central that can cause encephalitis and meningitis. Encephalitis is an inflammation on the brain, while meningitis is an inflammation of the protective membranes covering the brain and spinal cord. Other than that, the symptoms is retinitis cause inflammation in the retina of the eyes. The other sign and symptoms of AIDS are pneumocystis pneumonia, tuberculosis and tumor on the lung. Another symptom of AIDS are esophagitis, chronic diarrhea and tumors. Esophagitis is an inflammation that may damage tissues of esophagus. Furthermore, AIDS can cause skin tumors. You can't rely on the symptoms only to know if you have HIV. The only way to know for sure is to get tested.
Now we look into appropriate intervention or medication to treat AIDS. There is no drug at present to fully cure HIV or AIDS. However, by using ARV drugs, the progression of disease can be slowed down, which can prolong and improve the quality of life. A variety of medications for treating HIV and AIDS have been approved by the FDA. Drug treatments help to minimize your body's HIV virus, keep your immune system as healthy as possible, and reduce the complications that you can develop. The first drug is an RTI that can interrupt the virus from replicating, which may slow the spread of HIV in the body. Next is protease inhibitors, FDA-approved drugs that can interrupt virus replication at a later step in the virus life cycle. Another one is fusion inhibitors, a new class of drugs that act against HIV by preventing the virus from fusing with the inside of a cell, preventing it from replicating. And an RTI blocks the infection of new cells by HIV. These drugs may be prescribed in combination with other antiretroviral drugs. And also HART, often referred to as the anti-HIV cocktail, which is a combination of 3 or more medical drugs, including protease inhibitors and other antiretroviral medications. The Ministry of Health Malaysia has recently begun offering qualified patients a free first-line regimen of combination ARV medications called HART. This treatment is provided in major government hospitals and a few selected health clinics. Through adherence to ARV medication, medical care, good nutrition, and also with a positive mindset and strong support from the family and friends, people living with HIV or AIDS may have a long and high-quality life.